Abdominoplasty is a very common plastic surgery procedure. In this procedure, we really are looking to improve the contour of the abdomen and remove the excess skin. We also seek to bring the abdominal muscles closer together through a fascial plication, which is a procedure in which you tighten the abdominal fascia in order to give the patient a better abdominal contour, and this really gives them an overall improved look of not only the skin, but the underlying structural tissues as well. Abdominoplasty is often combined with breast procedures. I would say most commonly combined with breast augmentation or breast augmentation mastopexy, which is really where you lift the breast and then also increase the volume using an implant. It's also possible in patients that don't want a breast implant, but do want a more youthful looking breast to just do a breast lift combined with an abdominoplasty, and that can then rejuvenate both areas. In addition, a common procedure to add would be liposuction, especially liposuction of the flanks, or what's sometimes called like 360 liposuction. And this really allows you to contour the waist in combination with the abdominoplasty. A good candidate for this surgery is really a person who's kind of at their ideal body weight. Certainly patients who have excess abdominal skin and have had a creation of a diastasis. Most commonly, this is related to previous pregnancies, but this can also occur in patients who have not been pregnant. These procedures are really best done when the patient is kind of at their optimal health so that they can recover quickly and really get the best result possible. I would say to prepare for this surgery, really you just want to continue your normal routines. Certainly, a month before, it's good to make sure you're eating healthy, that you're eating a lot of protein. This will just help you heal faster. Certainly, patients who use any kind of nicotine product should stop several weeks before, because this really increases your risk of complications. Any supplements that you're using really should be discussed, with the provider to make sure that none of those can increase your risk of bleeding or healing difficulties. Generally, we have people stop their supplements, several weeks before an abdominoplasty. The day before surgery, really just, there's not anything truly special you would want to do except for obviously follow the directions from the anesthesiologist to not eat or drink anything after midnight. Recovery from abdominoplasty is definitely a process. I always joke with patients that the first week after abdominoplasty, you're 90% sure you shouldn't have done the surgery, but the second week, you're 90% sure that you should have done it. Because really that first week is the hardest week for most people, especially if you've done the plication and brought the rectus muscles together. I always tell people it's like you did thousands of sit-ups, but you were asleep while you did them. And so that's probably the hardest part in the beginning. You have to sleep a little crunched. So you have to have some pillows under your knees, pillows on your back. You're sleeping on your back. A lot of people aren't back sleepers and they don't enjoy that very much. But that's really that first week, and then slowly, over the course of the next week, you start feeling more active. You start getting your energy back, and the skin stretches enough that you can stand up in the full upright position, and then you just go on from there. Really, it's 4 to 6 weeks of recovery, total recovery, where you want to not lift any heavy objects, do any hardcore exercise. After 6 weeks, really, you can do whatever you want, and there's really no restrictions. The potential complications of abdominoplasty are actually pretty small. I would say the most common issues would be slow healing of the umbilicus or belly button. We keep your belly button attached to you. We bring down the skin and then make a new opening for the belly button. Sometimes, especially people who've had previous surgery around their belly button, this can interfere with some of the blood supply, and sometimes the belly button can take a little bit longer to heal. You can also sometimes get some thickened scar around the belly button as well. That can be addressed if necessary at a second procedure. We do put in drains in most patients, and despite that, you can get a fluid collection after we pull the drains called a seroma, which is where fluid stays in that area between where you lifted up everything, and that can require another surgery. It's pretty rare. Usually you can just drain it and move on. There's always a risk of bleeding and infection, which are standard with any surgery. These procedures in the well-selected patient have a very low complication rate, and it's uncommon for patients to need to go back to the operating room or have secondary procedures. Generally, patients heal well from this and are able to kind of move on with things after they've healed.